The signs and symptoms of a heart attack, they can be very deceptive because the heart doesn't have its own nerve supply. So therefore it borrows from the nerves of adjacent organs, okay? So what are your adjacent organs? You've got ribs, you've got lungs, your esophagus or your feeding tube, stomach. So often people can feel like a stomach ache or indigestion, or you can get shortness of breath. Often women only feel shortness of breath when you have gastroesophageal reflux, that kind of symptoms. Sometimes you feel tightness, and the tightness is basically around the lining around the heart is irritated from the heart attack. So those are your signs and symptoms. Can you feel anything else? Yeah, you can feel a pain or a heaviness down your arm. You can feel a numbness down into your fingertips, particularly the medial part of your hand and into your little finger. So those are kind of your little hints. These are not 100% symptoms. That you may not feel any of these things and you may be having a heart attack. In fact, 25% of patients have silent heart attacks. They don't even know it. And then your doctor looks at the EKG and says, oh, you had a heart attack. Because the symptoms are so deceptive, this is why it's very important not to minimize these things. Your indigestion may be coming from a heart attack. So what we need to do is go ahead and call 911 and take an aspirin. That means chew an aspirin. After you call 911, chew an aspirin, and then wait for help to come to take you to the hospital. Could it be indigestion? Yeah, it could be indigestion. So the emergency room physician will tell you it's only indigestion, fine, you go home. But what if it's a heart attack? Well, by the time you decide in your mind that it's a heart attack, 12 hours have gone by. And you will have taken antacids, you will have changed your position, you have moved around in your bed thinking that it's just indigestion, and then the heart attack has already completed, and you will either have A, died, or B, completed a heart attack, okay? Neither of which are good options. So I would rather take the option of going to the emergency room, being a little embarrassed, that's okay, but at least you're alive. What's the percentage? What's the percentage likelihood that if you don't do anything about it quickly, you will die? Right now, it's 30% chance that you will not make it to the hospital alive if you have any of those symptoms. So why is this important? It's for your life, and it's for the well-being of your family. Your family wants you around, you want to be there for your family, and you want to live. Therefore, call 911. What if you're observing someone next to you, you think that may be having a heart attack? If that's the case, you ask them first, how are you feeling, what's going on? And if they're sounding not right to you, if they're uncomfortable, and you think that they're having a heart attack, I would call 911. No harm done. The paramedics are experts. They're gonna evaluate the patient. They have EKGs and other material. And the thing is that time is of essence during a heart attack. Every minute that goes by is heart muscle that dies. So it's no problem calling 911, letting them evaluate you or your loved one. Should you know basic life support? Yeah, it would be very helpful to know basic life support. Why? Because sudden cardiac death is a very common presentation of a heart attack. 1 minute they're alive, they're walking, talking, next minute they're on the floor. And in order to save them, you have to know basic life support. So if you know basic life support, it would be extremely helpful and may save your loved one's life. Where do you learn basic life support? There's many centers. You can call your local hospital and they will refer you to a location where they teach basic life support every day. So yeah, basic life support is very important to learn. If you're having a heart attack or you think you're having symptoms like the ones I described earlier, and I would advise you, first of all, don't wait, call 911. Second of all, take aspirin, chew it, don't swallow it, chew it and then swallow it. Number 3, if you're a bystander or somebody standing next to this person, know your basic life support, especially if you already know you have a family member that has a heart problem. You should take the extra step and learn basic life support. That's the biggest gift you can give to your loved one. Know basic life support. Thank you.